Hello everyone, let's try to solve this question together. So based on the antenatal ultrasound finding, the best statement is, some findings are given on this antenatal ultrasound, and as you guys can say that this is done at the 38 weeks of gestation. So three important information is given. The maximum vertical pocket information is given, then they have given the biophysical profile, and then some findings on the fetal Doppler. So based on the information provided, what do you guys think is the right answer here? Okay, the correct choice here is continue to follow clinically. So first of all, let's see why the fetus does not have significant anemia or does have. It all depends upon, if you see here, the middle cerebral artery peak systolic velocity is given, and I will show you later how we can assess fetal anemia using the middle cerebral artery systolic velocity. So this answer is wrong, and like I said, I'll show you later. Amnioinfusion should be considered. Again, amnioinfusion is indicated for oligohydramnios, but if you see the maximum vertical pocket, it looks all good. And again, I'll show you later what are the normal measurements. And delivering the fetus immediately is not indicated, because look at the biophysical profile. The biophysical profile is 8/8, so all is good. So basic idea about this presentation is that one has to know the concept of maximum vertical pocket, assessing the amniotic fluid around the baby. Second is biophysical profile, that indicates how the fetus is behaving, and of course diagnosing anemia based on the middle cerebral artery. So let's jump into that. So this is the information about the maximum vertical pocket, and you guys can see that normal range is from 2 to 8, and here you see all looks okay. So this all are okay except for one pocket that is a little deep, but again 3 pockets are within normal limits. So this does not look oligohydramnios definitely, so there is no need for amnioinfusion. So now what about the biophysical profile? You guys already know it, but just to touch base, that is a 5 component, but sometime we don't have time to do the non-stress test, and that is omitted. So a score of 8/8 is considered good, and you don't have to do anything, while a score 4/10 or 6/10 is concerning. So just a review of biophysical profile. So now let's go and talk about what and how we go about the middle cerebral artery ultrasound. So this is the findings again. As you guys can see that they have given the velocity, and they have already calculated the MOM, which is the multiple of median, and I will show you how we calculate that. So basically this is a nice website. So what you do, you just put the gestational age here, and you put the velocity, and you hit calculate, and it gives you the multiples of median. And here you see that as the interpretation said, that if your multiple of median is less than 1.5, there is no anemia, but if it's more than 1.5, then this is anemia. So basic concept is honestly just like looking at anything with the mean value and seeing how many patients have above that. So easy to get it. This is in this example, the alpha fetoprotein is used. So basically you put the patient's results here, and of course you do the median. This is already being done in this app, so you don't have to. And finally you get the multiples of median. So here if the multiple of median is 2 for alpha fetoprotein, then the patient is at risk. And for specifically for MCA, peak systolic velocity, remember 1.5 is the multiple of median. So in summary, if you are given the MCA, and MCA has a number, the velocity, you put it into this app, and it calculates the MOM. And you don't have to do that like you saw here in the example, that how the ultrasound machine has already given you MOM. So it's given, and you see if it's less than 1.5, you know that there is no need for any intervention, because this fetus has no significant anemia. So I hope this is a long presentation, but I hope you got the concept, and please do subscribe to our channel, and you guys have a wonderful day. Bye.